Here, we are going to expand our toolbox and talk about tips for tremors in life. And I want to include some other diagnoses alongside Parkinson's disease as well. So here we're going to cover 8 different treatment interventions, including forearm cooling, stress management via the 5-step stress reduction hand tremor control approach. We're going to talk about proximal stabilization. I'm going to teach you something called finger flicking. Then we're going to discuss weighted utensils, wrist weights, dual tasking. I'm going to give you some resources on adapted equipment, and then we're going to end with some exercise-induced tremor reduction modalities. Now, if you find something insightful, helpful, educational, please press the like button below this video. Check out my channel. I'd love it if you would subscribe, press the subscribe button, and then you get notifications of other videos and exercise programs to come. Number 1 is forearm cooling. The research is there. They call this cooling-induced tremor reduction, but they think it's because of a decrease in nerve conduction velocity as well as a change in the muscle properties. Now, in the link below, I've included a PDF from Tremor Talk, and it's going to explain some of the research articles that support this with essential tremor, MS, as well as a protocol if you want to try it yourself. Basically, you can put ice packs above the wrist, below the elbow, 10 to 15 minutes. According to the article, they claim a tremor reduction up to 1.5 to 2 hours later. So check out that PDF in the description below. Number 2 is stress management. Okay, I have noticed a lot of times when my individuals who struggle with tremors approach a functional task, there's often this anticipatory anxiety. On top of that, there's often an overcompensation, kind of difficulty calibrating our grip because we're trying so hard to control that tremor. So to address a lot of this overthinking and over preparation, there is a protocol called the 5-step stress reduction hand tremor control approach. This was created by Linda Liang. I'm including a PDF of this protocol in the description below for you to kind of explore on your own. But the article says it is a novel, non-invasive approach to reducing action hand tremors. I'm going to briefly go over this approach. I'm going to read the protocol word by word so I don't taint it with my interpretation, but I will let you know when I input my personal experience as we go. Step 1, the therapist instructs the patient to use less strength when engaging in a task. The purpose here is to decrease the exerted effort. She says to use the cue, touch it like jello. They had a case study of a 65-year-old male grasping cups, a 51-year-old female grasping silverware, as well as writing. And the purpose of decreasing the strength there is to try to improve that internal self-control. Step 2, the patient is given the verbal cue to just do it, to reduce body tension. Now, she says that research shows that tremors can actually increase with the visual input. Therefore, have the patient look away. Now, if their tremor increases, just stop and restart. Step 3, the therapist facilitates regular hand coordination training with the patient's affected hand. All right, insert Elizabeth. I have found better results and the research supports more task-oriented training. In other words, if you want to improve your handwriting, do some handwriting. And the research supports this. For example, there's been many studies on individuals with Parkinson's doing things like grip strengthening and therapy and exercises. And yes, they have found improvements in the actual strength, but a lack of sustained carryover in the functional task. So I like to make and do busy boxes for my patients who come in. If they want to focus on buttoning, let's put some buttons in there. Practice the actual task, focus on their goal. Step 4, the therapist addresses the patient's psychological coping skills, such as learned avoidance behaviors, negative self-judgments, and anticipatory anxiety. Now, if you feel like this is out of your scope, there's some great resources out there for you to refer to. One that I personally like is the Mindfulness and Acceptance Workbook for Anxiety. I'm including a link of this in the description below. There's other resources. If you have one, go ahead, comment under this video to share with others. But her actual protocol encourages therapists to say or cue, let's just relax. And you know what? Let's try. I personally, this is me, have recognized a few faulty cognitive patterns. A few common ones are polarized thinking, kind of black and white. I fail or I succeed. Filtering, focusing only on the negative and not the positive. You know what? Sure, I put my lipstick on, but I couldn't do my eyeliner. And then catastrophic thinking, assuming the worst. Imagining yourself walking up to the buffet and spilling food all over. So if you struggle with any of these cognitive faulting patterns, anticipatory anxiety, go ahead, check out some resources that might really help your hand tremors. And last, step 5, the therapist incorporates Qigong, which is an ancient Chinese practice of holistic healing, into a home exercise program to treat action hand tremors. Now, the problem with this is it really should be conducted by an experienced practitioner. So for that reason, I've outsourced and recommended Tai Chi, meditation, pursed lip breathing, mindfulness. But for your sake, in a PDF below, I have included an exercise program for relaxation, and I found it on the International Essential Tremor Foundation. Our third treatment intervention is proximal stabilization. Okay, our limbs have what's called degrees of freedom, where each joint can move in all sorts of directions. For example, from my shoulder to my wrist, I have 7 degrees of freedom. My shoulder can move up and down, to the side, and in and out. That's 3. My elbow can bend. It can rotate. That's 2. My wrist can bend up and down and go in and out. That's another 2. 7 degrees of freedom right there. So what we can do for tremor reduction is take those away. So if I'm going to put my lipstick on, I'm going to tuck my shoulder down, take away 3 degrees there, okay? Maybe just keep my elbow here, take away 2. And now if I hold my wrist there, maybe with my other hand, or using something like a wrist cock-up splint to prevent that movement, I've taken away that degree of freedom, okay? Found individuals who have Parkinson's a little more success like this, or moving the head. Essential tremors is a little bit more difficult because of the head movement there, but basically proximal stabilization is take away those degrees of freedom that might really help you with your tremors. Number 4, I want to teach you finger flicking. Okay, I learned this in my LSVT big training for Parkinson's, but a lot of times with Parkinson's, there is what is called a sensory motor disconnect. The brain is not getting the correct feedback from the body. That individual may think that they're walking at a normal stride length when they're shuffling. They may think they're projecting their voice when they're whispering. Not their fault. There's just a disconnect here, okay? Brain's not getting the correct feedback. So we can override this by being intentional, or we can do high, big amplitude training. Everything big. Talk about this in my tips for freezing for Parkinson's. I'm including a link of that video in the description below. But finger flicking is right before you do a functional task. Take those hands, flick them big. 5, 6 times, okay? Big, and then do a little wiggle. Do your task, whether it be putting on your lipstick, buttoning your buttons, finger flick, and it really might help those tremors. Number 5, let's discuss weighted utensils and wrist weights. Okay, weighted utensils. The research is not there. If you don't believe me, check out the research articles in the description below, despite what a lot of Parkinson's articles and blogs recommend. One of the studies even showed improved performance with lightweight silverware than weighted utensils. Check it out. In terms of wrist weights, now the research here is mixed. They have found benefits with MS, essential tremors. Check out the research below. I have found improvements in terms of the wrist with wrist cock-up splints, something to stabilize that wrist like we talked about in proximal stabilization. In terms of proprioceptive input, I have found benefits using the environment. So for example, individual with MS struggling with brushing our teeth. Use our environment. Prop against the wall, trace our arm along the wall, use an electric toothbrush, and there we go, using our environment to provide that stability. Number 6, avoid dual tasking. A lot of this has to do with that layer of anxiety and stress when our brain is trying to do too many things at once. I talk about this in my video on tips for freezing, which I'm including a link in the description below. Number 7 is adapted equipment. There are so many cool resources out there. I'm going to put a link in the description below with some of these resources for things like clothing, utensils, technological resources, like computer mouse that has an anti-tremor filtering in it. If you have an assisted device that really helps you, please put it in the comment below. That way maybe you can help some other people. Number 8, last, let's talk about exercise-induced tremor reduction modalities. The research is there. Let's start with Parkinson's disease. For Parkinson's disease, exercise is medicine. It has a neuroprotective benefit and changes your brain via exercise-induced neuroplasticity. No doubt the research is there. So a few avenues: high-intensity cycling. I've seen this. I've had my individuals write a sentence, get on the bike, cycle for 20 minutes or so, come off, rewrite the sentence, and I've seen improvements. Other avenues is boxing, LSVT big, high intensity, eccentric training. This is where we strengthen the muscle during the lengthening phase, like a bicep curl or a squat. I put research articles to support all of that below. And last but not least, I included an article that has 7 hand exercises specifically for Parkinson's disease just for you. For essential tremors, the research is there as well, especially for resistance training. I included an article below where it has shown that it has reduced the impact of the tremor as well as the amplitude of the tremor. One of the studies did bicep curls, wrist flexion, and wrist extension. And don't forget, I have that PDF of relaxation exercises just for you. Before we end, I want to thank you for checking out my channel. If you found something insightful, educational, please press the like button below. Check out my channel with other videos and press subscribe below so you can get notifications when new videos come out. I have other educational videos, resources. Also check out my exercise programs. If you like one, I'd love it if you would jump in and join along, because together, little steps, we can make some big gains.